I'm Cheris Spielman, Certified Specialist in Oncology Nutrition at El Camino Hospital Cancer Center. During cancer treatment, the smell and taste of food may be different to you, and it makes food less appealing and more challenging for you to meet your nutrition goals of adequate calories, increased protein, and increased fluids. Why does taste changes occur? It's often a result of the chemotherapy agents that affect your taste buds. It can be due to radiation to the head and neck area, which affects your saliva, part of the digestion process. So whether you're a kitchen foodie or comfortable in the kitchen or not, I have tips for you to help you bring back the yum factor in your meals. I'd like you to think about getting 4 ingredients at home, what I would call flavor enhancers. I've got extra virgin olive oil, pure grade maple syrup, a fresh lemon, and rock salt. So let's demonstrate how you would use each of these ingredients. I'm looking at this broccoli and potatoes and it's not quite tasting like anything, maybe even like cardboard. So I'm going to use a few granules of salt, and salt sort of stimulates the nerve endings of your taste buds and brings out some of the flavor of your food. Try that and see if that works for you. Secondly, if it's not quite doing it, take a fresh lemon and squeeze just a few drops. That will intensify even more flavor of the food that the salt has brought out. Third ingredient, if it still doesn't have quite that yum, still not appealing to you, is using a little bit of pure grade maple syrup, drizzling a little bit on. Sounds strange to put syrup on vegetables or potatoes or starch, but it's a caramelization process that chefs use all the time. Now I still have one more flavor enhancer to use if this isn't cutting it. Extra virgin olive oil, drizzling that on because fat is a carrier for flavor, and this is a healthy fat. Hopefully using 1, 2, 3, or 4 of these ingredients will help you bring the yum factor back to your meals. Some of you may have a heightened sense of sweet. That's when you want to go directly to a lemon or balsamic vinegar on your foods. If things are tasting too salty, go to your sweet. If things are tasting metallic, then I encourage you to eat your meals with plastic utensils, whether it's a fork and knife or if you're comfortable with chopsticks. That will reduce the metallic taste transferred from your metal flatware. I often, going along the theme of metallic, some people think that water even tastes different during treatment. And that's when I encourage you to infuse water with fruit or herbs. I have lemon and mint or strawberries, and that can make water more appealing so you achieve your goal of increased fluids. Now, if you're a little more comfortable in the kitchen, then try herbs and spices. Herbs are things like oregano, basil, thyme. Spices like cumin, coriander. Add those while you're cooking with a little bit of olive oil to help carry that flavor through food. Experiment. Go ahead and try something new. The other thing that's helpful is cleansing your palate. So take some baking soda, 1 teaspoon, in a quart of water, swish that solution and spit it out. I'm hoping that you'll find some of these nutrition management tips for taste changes helpful to you so that you can eat your best to feel your best during treatment for cancer. I'm Cheris Spielman, Certified Specialist in Oncology Nutrition at El Camino Hospital Cancer Center.